Steve, good morning.
Morning, RuQuan. Good to see you.
Yeah, thank you, man. I'm excited to be here to have this conversation. Frankly, I'm excited because you are an older white guy. I'm a 21, almost 22-year-old black guy who we are both extremely intentional about the impact we want to make and the way we want to change the world, and that's what brought us together. And so I'm excited to have a conversation and you know, sort of take away some of the paradigms and principles people have related to who makes change, what arenas people make change in, why the change happens. And we've been able to talk about that a lot, so I'm excited to keep having that discussion.
Yeah, me too, RuQuan. It's been a pleasure getting to know you, and it's just been an honor to have those conversations.
Thank you. I feel the same way. I want to talk a little bit about how we met, Steve. Even before we introduce who we are, I want you to tell me what your experience was when we met last school year in Professor Roland Fryer's course.
Yes, well, I mean, as you know, I was asked to be sort of, I guess, a guest lecturer. I'm not sure what they call it at Harvard for one of the classes for Professor Fryer. And, I talked about my experience at the Food and Drug Administration as a cancer doctor, as a human being. And just, it was a pretty broad-ranging conversation and how that is connected to some of the things we need to do in the world around innovating to help human beings, humankind, particularly in health and healthcare. And you were sitting, I think, in the third or fourth row to the right. I'll never forget it. And you raised your hand and asked me a question. And as is typical, now that I've learned about you, that question was, you weren't shy and you weren't afraid to ask tough questions or what could be perceived as tough questions. And you asked me a question about the Tuskegee Airmen, which of course, in relation to how do we develop products to help people get better from health conditions, it's a very, very important moment, tragic, bad moment in our history, but an important one to acknowledge. And I think that conversation started our relationship because I said, yeah, it's a real problem. I mean, it is an issue that started the lack of trust between the African American community, maybe other groups in the country as well, and the medical establishment, and particularly around clinical research. We've struggled with this for years. So just the fact that you brought it up, and frankly that you were willing to listen to this older white guy give his answer to that, really struck me as not provocative, not in my face, but really wanting to understand how I thought about it because you had your perspective as well. And then that just morphed into a conversation. We met for coffee and we talked about the power of love, about the power of being there for people, maybe even that there's more that binds us than separates us, and how that's a really important thing for us never to forget.
Do you think about at all the idea that it's revolutionary for someone like yourself to take this perspective on humanity, on service, on providing transparent and effective options for care, breaking some of those barriers of communication between groups of people, whether it be the medical system and poor black people or else? Do you understand the potential, the impact in it, and also the potential for impact?
I think I probably don't understand the potential for impact, but I'll tell you, to me, it's not something that I'm unfamiliar with. So when I was a doctor at the University of Pennsylvania taking care of patients, I took care of patients at Presbyterian Hospital, which was in one of the poorest neighborhoods in Philadelphia, in West Philadelphia. I absolutely loved my practice there. And I learned there that it doesn't matter what you look like. That at the end of the day, coming through that door with a diagnosis of cancer, pretty much the emotions are the same. You bring your family, you're really afraid, you don't know what to ask, you need someone to be on your side. And you have a conversation, and you be authentic, and you tell people the truth. Because people know when you don't tell them the truth, and that's not the reason to tell the truth, but it's really important to do so because someone's life's at stake. So no, and frankly, that's why I don't feel like our conversation was was or should be out of the ordinary. Maybe it is. Maybe I just don't have a good understanding of that. But it's the way that it should be, in my opinion.
Yeah, well, you know, some people's gripe with doctors is they feel like doctors specialize in one area, but lack that larger perspective. So it's always phenomenal when we see ourselves get uncomfortable, push ourselves to be better. And to me, better means to understand each other more, because we're talking about solving the world's issues in tech. That's what they're describing in Silicon Valley with crypto and with venture capital. Everybody's saying that they want to build the best products to make humanity better. The academics are talking about using research to change the world, right? All the professors are, have research labs or writing books to move the needle, but most people are not just sitting down and having conversation. And so I see that as powerful.
Absolutely right, and it's somewhat siloed like you described, but the other thing that I see is we're often afraid to actually speak the simple truths that everybody knows exist. Yeah. And so if you had asked me that question and I had given you some BS answer about Tuskegee, that you knew I was trying to either cover it up or not acknowledge the trauma and the problem associated with that, we wouldn't be having this conversation now.
Yeah, no, probably not.
So let's be honest about what happened. Let's have that conversation. Let's talk about the issues and try to come to some understanding. Yep. Not that it solves the underlying issues, but begin to have the conversation.
Yep, awesome. So, Steve, I wanted to make sure that we got an opportunity to hear what motivates you, what inspires you, what makes you do the work that you're doing. And I got to see a little bit of that in this conversation thus far. What I want to know is, professionally, who are you? How did you arrive at where you are now building Harbinger Health?
So I get asked this question, what are you? Because now I'm the CEO of a biotech company, but what I really am is still a doctor. I'm also a parent, a father, a grandfather, part of a big family. It's really probably one of the most important parts, my faith, which is also hugely important to me. So all those things go into who I am. When I grew up, my parents emphasized two things: education, family, and faith, or three things: education, family, and faith, not necessarily in those orders. And that stuck with me my entire life. So all those things mixed together led me to be a doctor. I had just a privilege to allow to enter people's lives and help take care of them and help them through some of the most difficult and dark times. And then I got into healthcare administration, MD Anderson at Penn, where I decided that maybe I could make a bigger impact by helping other doctors with practice and increasing access for people, et cetera. And then I went to the FDA. And of course, probably the most transformative experience that I've ever had in my career, in that we had the once in 100-year pandemic, hopefully once in 100-year pandemic.
Yeah, hopefully, right?
And I took two big lessons away from there. One is the importance of the private sector, how we've done a reasonably good job in our country, maybe around the world, of having a private sector that is enabled to develop innovative products that can be brought to patients' and providers' lives. And the other one was how we still haven't solved the problem of the underserved, how we're leaving too many people behind. And they're somewhat juxtaposed in that on the private sector side, we're developing these new therapies that are really expensive, which makes access really difficult. And on the other side, we have folks who maybe don't have trust in the private sector and in business and in doctors and in medicine and in science. And to me, I thought I need to do something to help bridge that gap, because we have such good things going on here, we can solve this other problem. So I ended up in biotech and at Flagship Pioneering and ultimately Harbinger Health, because I really wanted to help solve those problems. And one of the things at Harbinger that we're really focused on is access. How do we make what we're developing accessible to people who need it the most? I'm not just talking about people on the coasts, people who can afford to go to concierge docs. I'm talking the grandma in East Texas who gets her blood drawn but maybe doesn't get her CAT scan or her colonoscopy that she needs for cancer screening. How do we get to those folks? And that's not just making something affordable for insurance companies, Medicare, Medicaid to pay, but that's also like, do you trust me with your health care? And that is something that you have to earn. So I had to earn that as a doctor, and I want Harbinger Health to earn that now. So that's kind of how I ended up here, because it brought together two things that are just very important to me. We're going to make an impact in improving people's lives and having more people live and not die from cancer, then we're going to do those things.
Yep. And the part of why you and I are here is to address the difficulties that have arrived because of some of the traumatic and catastrophic and even criminal events that have occurred throughout history. We can talk about human trafficking as a medical crime because of the conditions that those who are trafficked from West Africa to the United States of America or to the colonies at the time, the conditions are far below the FDA's standards, right? And the conditions on plantations and even the conditions in many of the neighborhoods and schools today. We can talk about that. We can also talk about Henrietta Lacks and her body being stolen for the advancement of an entire system that still, like you described, leaves out her descendants, her ancestry, and the people that come from her. That's tragic because that conversation around access is a two-way street. The one who desires access has to be open, and the one who's giving access has to be humble and open too. And so Harbinger Health, Steve, and the others who are curating products, how do you discuss amongst yourselves in the doctor community, in the healthcare community, but also with patients? How do you actually address that history? Is that something that happens on a case by case? Is that something that happens in the boardrooms? Where do you do that work and how does it happen?
Well, if you're talking about an interaction with a patient, typically specifics, Henrietta Lacks, and I'll describe that in a minute, and Tuskegee Airmen, doesn't come up. It's always hanging out there, but in terms of a conversation with the patient who has a cancer, it's really about them, and they get to direct the conversation about what their hopes and fears are. But as I mentioned, if someone brings it up, we talk about it. And we should have that conversation now. We should confront, acknowledge, talk about what happened. Brushing it under the carpet doesn't help because it's in the back of everyone's mind. But really with one-on-one patient, it was about building trust with that patient. Do I actually care about you? Do I actually have your interests in mind? Do I have any other motivation than making you better? And you know what's great about human beings? If I don't, you will sniff that out within 5 minutes, maybe less for you, RuQuan, I don't know. So it has to be authentic, it has to be real. You have to actually really care and want someone to get better. And that is a problem sometimes in the medical profession, I'll acknowledge that. But if we go back to your question around the Tuskegee Airmen and Henrietta Lacks, these are issues that we need to overcome, but we need to acknowledge them. So Tuskegee Airmen, as you know, were a group of individuals in the military who were experimented upon without their consent with a program around syphilis. Now think about that. That's akin to prisoners of war in World War II being experimented upon, which of course is against the Geneva Convention. That episode in our history, which is shameful, led to some very important reforms about who could enter clinical trials and experimentation and who couldn't. So that's the positive outcome from it. But what we didn't do, I don't think, is address enough the negative impact of that and have a conversation about it. That there are, and actually not only tell people there's safeguards in place, but actually show it and do it and have people live that as part of their experience. Because at the end of the day, we've compounded tragedies. That was tragic. But now we have folks who don't want to participate in clinical trials because of that, and totally understandable. Like I would feel the same way if I were part of a group that was impacted by that. Yep. But some of the best care that takes place around the world is in clinical trials of new therapies. Some of the best care, studies show us that. So how do we help folks come to an understanding that helps them make that decision with complete autonomy around that, and then decide whether they're going to participate in that? Not ignoring what happened in the past, but moving beyond it to actually get to a better place. So that's one of the central challenges. Henrietta Lacks, as you know, amazing medical accomplishment when her cervical cancer cells were taken. First human immortalized cell line used in the lab. They're called HeLa cells after her name. Her family didn't, she was born in 1920, died, I think, 31 years later, something like that, in the 50s. Her family didn't find out that that cell line was created until 1975, been used around the world to help cancer research. Now, there are safeguards in place. People actually have to give their consent for that. It doesn't help Henrietta Lacks and her family. It doesn't solve that problem at all. But there are now significant safeguards in place. Now, I'm not trying to justify it. I'm just saying, let's talk about what happened, how bad it was. Let's see how we can do to solve that problem. Let's actually have a conversation with the Lacks family and acknowledge the contribution. Maybe there's other things that we can do as well.
Yeah, well, we're thinking about who we want to talk with on this show, and I'd be more than happy, if possible, to speak with that family in particular, because like the cultural impact, but also the opportunity for advancement in the sciences and with product, because the fairness around product, who gets to be a part of the product design, whose DNA we're using, whose ideas we're using, all those things are a dicey conversation at this particular time.
And you know, also, RuQuan, and I'd love your thoughts on this. Every day on our phone and our computer, we give consent to companies to use our information. Every darn day, Americans or people around the world are doing that. That's also another piece of puzzle, but we're giving consent by clicking that button.
Yeah.
It's a big deal.
Yeah, it is. It is, and that's why these conversations are so vital. This is like Einstein being in the lab on the first iteration of the equation. It'll take maybe 5,000 more tries, 5,000 more conversations, 5,000 more legislation drafts, 5,000 more emails with the important people or the decision makers and the stakeholders, 5,000 more pitch decks to finally fundraise for that company or that idea. But if you don't start on that first iteration, then you don't arrive. And this is that. This is that because we are leaders in our fields, and the world is inspired when we take on the biggest challenges. Because the same way that it was jarring, yet inspiring and capturing and captivating, you know, for me to come to you and say, Steve, I like this product, but I think you're leaving out a group of people it doesn't seem like are being mentioned, or I think there's gonna be some tension there. How do you address it? The same way that that was captivating from your experience, it is captivating to the world when we address these issues that they know exist, but people don't have the bravery or the courage or the belief about what's possible. But that's what I think is so dope, because if you and me are willing to look each other in the eyes, despite being different industries, different age, different race, hold hands and say, how can we, even though we design different products, how can we talk about product design in a way that changes the world for your new baby, or changes the world for my siblings, or changes the world for our families, our spouses, whatever else exists. And I think that those are the important conversations. So Steve, when I think about, I'm graduating from Harvard, you know, in 5 months. And I'm thinking about, what does that mean to my community, to poor Black people in this country, but also around the world, who have been told for 400 years that they're not smart, they can't read, they shouldn't think, they should be hyper left or hyper right. What does it mean for us? Does it mean something for us? Is it a conflated idea that my success actually means something to poor Black people, or any people for that matter? I'm asking myself all of these questions, but the thing that remains true is something we talked about, and for me it's love. It's because no matter if everybody in the hood around the world cares about me graduating, or it inspires them, Steve, the help is still needed in those communities. And we know, even in the most prestigious or esteemed communities, help is necessary. Steve, tell me about how you balance this care for the underserved with this communicating with the overprivileged. How do you make those two worlds work together? How do you make these ideas be important to audiences that may not have the biggest motivation to serve here?
Yeah, it's a really big and important question. But first of all, if I may, and at the risk of being presumptuous, RuQuan Brown is more than Harvard. just so you know.
I mean, no question, absolutely,
And,
wholeheartedly.
and it is an incredible accomplishment. You did it. It's a honor and reflection on them, frankly. And I think you're going to do great things with it. But I can't answer, of course, the question of how communities that I don't belong to, how they feel about it or what it does for them. And I just hope folks are inspired by it, as I am. So this is a really interesting question that you're asking, because this gets to the crux of what we're trying to do in terms of cancer screening. And it's not just cancer screening. There's a lot of other problems that we need to solve by addressing this. There's what is described as the elite, and often sometimes pejoratively described as the bi-coastal elite. There's a lot of people on the coast who aren't elite and who live lives that aren't as advantaged as others. There's a lot of people in the center of the country the same way. And there is a significant divide there. And we've seen over the last couple of years a significant amount of distrust. And I was part of that when I was at the FDA during COVID. We saw that trust erode and that mistrust and that gap increase. And again, I think it gets back to a couple of things you said. One is benevolence, giving each other the benefit of the doubt, love for each other, but also telling the darn truth. Like, even if it's inconvenient, even if it's not what you want to hear, telling the truth. And we saw that not happen a significant amount. And people understood that, they saw it. It might have been colored by their background and their experience, but people saw that. And that just set us back. So what I want us to do to bridge that gap is simply tell the truth as we know it. Maybe my truth, and I hate to say that because there should kind of be a truth, but maybe the way I see things gets shaped by the way, I hope so, that you see things, and we mold and we shape in a way that benefits folks, everyone. Because that group that's elites and that group that's not, they're both going to get cancer. 50% of American men and 40% of American women will get a cancer in their lifetime. Those are the facts. Regardless of socioeconomic status, regardless of how much money you have in the bank, those are the numbers. Now, some folks are disproportionately affected by having worse cancers, and again, that's something that we're going to need to address. But it's a great equalizer there. So let's have a conversation about that. Why should the folks that have medical insurance and go to concierge docs get access to cancer screening? Why should that be? And how can we overcome the barriers of mistrust that keep folks from entering that space? The last thing I'll say is the following. When I was at the agency, at the FDA, during what I refer to as the vaccine wars, we had a conversation with an African-American women's group. And I remember the leader of the group raised her hand and said, why do you folks, meaning I believe folks in the government, always come to us when you need us? And I stopped for a minute and I said to myself, yeah, you know what? That's right. I don't want to go to folks about cancer screening when I need them to buy a product from Harbinger Health. I want to go to them now when we can talk about the inequities, about the reason it's important, and about what we can do as a community, as a world, to overcome the mistrust and the barriers to getting that. Once we get that done, that's great, but then there's a whole nother second, third, and fourth level.
Yep.
Access to care, best doctors,
Yep.
the whole bit. But let's take a little bit at a time, and once you build that trust, move on. That's kind of where I am.
Yep. Well, I get it. I want to talk a little bit more about your time at the FDA, but most particularly, help our listeners that don't understand what is the role of the FDA and even what their role is in deciding the vaccines in 2020 or around that time.
So the FDA's mission is to promote and protect the health of the American people. It is an agency of about anywhere, it depends on if you count contracts, but 18 to 20,000 individuals. It's stationed around the world, and it has the responsibility for safeguarding, if you will, the entry of medical products and food into the market. So for the most part, you cannot commercialize a product, a medical product that goes into the hands of consumers, patients, or providers without going through the FDA. And they have a dual approach to this, and that is what's safe and what's effective. And a common misconception about the FDA, it's like anything else in medicine, there's nothing 100% safe and there's nothing 100% effective. It's always going to be a balance for the two. So I'll give you a couple examples. A vaccine. Because you're giving a vaccine to healthy people to prevent a disease, like the flu, it has to be pretty darn safe. Because you're giving them something that if you make them sick and they're not already sick, even though you're trying to prevent a disease, that's very different than if you have stage 4 advanced pancreatic cancer, where your survival is basically 0, and you do a therapy that you approve that has more toxicity, more side effects. That's a more acceptable, because if that has a benefit in terms of extending life, the risks are worth the benefit. That's the decision that the FDA makes every year. But there is no absolute here. So let's take the COVID vaccines. We had a time in our country in 2020 and in 2021 where hundreds of thousands of people were dying in very short period of time. Maybe 100,000 folks per month were dying of COVID. Mostly the most vulnerable, older, younger, immunosuppressed, folks who have chronic diseases, obesity, et cetera, smokers. So there was an imperative, because of the number of people that were dying, to get a vaccine that was safe and effective. Now, normally it takes 4 years for the FDA, on average, to approve a vaccine. The FDA did it in 10 to 11 months, along with the private sector and the government that funded that research. So our tax dollars went into that, and we accelerated the process. We compressed that authorization process. Now, that's not a full approval, but does it reach a threshold of effectiveness and safety that we think is reasonable from that risk benefit to prevent 100,000 deaths per month? I mean, it's pretty simple and straightforward when you think about it. Not in terms of the assessment, but in terms of the calculus that you have to have.
Oh.
So where we fell down is not properly communicating that to the American people. So yeah, there could be side effects we don't know about. And by the way, any vaccine or medical product, even if it takes 4 years for approval, there could be side effects once you commercialize that we don't know about. It happens with every medical product. It was just focused on and accelerated by the COVID pandemic. So nothing really changed from the way the FDA does its job, except for more compressed in terms of time and also a lot more attention to it. That's a good thing, because the American people need to know what the FDA does and need to acknowledge, what there could be in terms of risks and benefits. But the flip side of that is then how does that translate into policy? And that's other folks other than the FDA. But do I mandate that you get a vaccine? Think about that. These are authorized vaccines. They haven't gone through the exact same process that other vaccines are. Do I take the autonomy away from you from making a decision about that? And do I do that in the interest of public health? Very difficult ethical conversation. I can tell you where I personally came down. I came down publicly against mandates, because I felt like we just need to communicate and be honest with people and tell them what the vaccine can and cannot do and what are the unknowns. Just like I would talking to a patient. Mm-hmm. I don't think we did that particularly well.
Yeah, it sounds like your remedy to the mistrust that we're describing is in that transparency and is in that truth. We're talking about marriage a little bit, and we understand the importance of the humility, of the honesty, of the transparency, because my favorite art medium, I paint and make music and do digital media and do fashion. My favorite medium is family, because humans are the greatest product to ever live and to ever be created. And we are constantly getting software updates whenever we are vulnerable with our family and our friends. And if we have the newest software, we can do the coolest things. We can invent the dopest products. We can change the status quo for self-esteem, for cancer care, or for whatever else.
I love that analogy. I never thought of it that way, software update. It's beautiful, actually, and it's so true. You can see the connection there. And at some point in this conversation, I want you to describe what you thought about our first interaction.
Well,
and like thinking that this old white guy's not gonna, whatever.
No, I give every person a fair shot, Steve, because like being a young black man in America, I know what it feels like to be labeled and judged before I even open my mouth. See, I could not say a word and someone already have decided who I am, where I'm gonna be in 5 years, who I hang out with, if I do drugs, if I have ideas. And most of the time people are wrong about me, and they're wrong about a lot of people. But it's because they're usually wrong about themselves too. Most people can't identify with themselves. Most people can't properly articulate who they are. So those type of people, I don't let tell me who I am. Because if you're blind about you when you look in the mirror, it would make me foolish to believe you about what I look like. Because you're most familiar with you. So if you can't see you, then me listening to you about me would be crazy. So I don't do that. Instead, I give people a fair shot and I say, let me ask you. Because what that is, it's like when your phone asks you, hey, do you want a software update? And you keep pressing later and later and later, but I am that notification to challenge us, humanity, to challenge us to love differently. And so my questions pose as an opportunity for us to engage in a way that's probably unfamiliar. It is unfamiliar to most humans because we don't ask each other intimate questions. And so I figured I must do it because my contribution to this classroom, to this institution, to this world, to the dead and the ones who aren't born yet, is to tell the truth. But it's also to ask the questions that will make us tell the truth about each other, about ourselves, about our desires for tomorrow, and about what happened yesterday. So, Steve, I feel like everybody, we talk about it, I love design, I love products, Steve. That's what we're here for, is to create things that are gonna improve our lives as individuals, but mostly improve the lives of those who are gonna be here after us, Steve. So I gave you a fair shot, Steve. And the reason that I'm happy I did that is because it has us here. Finally, Steve, so many people are missing out on opportunity. This is a product that you and I designed together. This experience that people are gonna get, the software update that the people who are in the studio are getting and the people that are in the world are gonna get when they hear it. But it's because you and I were willing to, in our own time, have these software updates, push ourselves with family, push ourselves with friends, push ourselves in faith, so that when we meet other people who are asking tough questions, we're not offended. We're used to that. If you're the head of anything, you have to deal with some tough questions. But if you're the head of the most important decision-making entity in maybe the world for a 2 or 3 year period, certainly, and maybe even for longer than that, before and after, then you certainly have to be okay with tough questions.
Amen, RuQuan. Actually, in what you just said, you kind of described a lot of what I always think about. I've heard you say what RuQuan Brown is. You know, it's interesting about that. My parents used to call it kindergarten rules. Kindergarten rules, you know, just kind of follow, play nice in the sandbox, put your toys away, etc. But always tell the truth and always do the right thing, as you know it. And then
that's so hard though, Steve. Like, even for you and me who really like telling the truth and really like doing the right thing, somebody's gonna tell us, Steve, that it's just not that easy, and you and me know that. How do we decide, Steve? Even when the consequences are dire, how do we choose truth and faith and those things?
When they're the most dire and difficult is when you absolutely have to do it. I remember when at the FDA during times when we would get, you know, pounded by the press and by congressmen and the White House, et cetera. And, you know, the communications folks would say, well, what do we say? And to me, it was always very easy. Even if you weren't inclined to tell the truth, what you should always have in the back of your mind is that someone will find the truth. And so if you don't tell the truth, it'll come back to haunt you. That's not the reason to do it. But if you were,
if you need some motivation,
that's really, a little motivation, that was it. But at the end of the day, the American people are not stupid. African Americans who mistrust the medical system aren't stupid. They know when someone's not telling them the truth. They know when someone's coming at them to get something from them. So let's just tell the truth and let's just acknowledge what's real. Maybe we disagree about the solutions. My guess is we probably don't. But let's at least have that conversation and tell the truth. And if you get beat up personally because of the truth, and during a 1 in a 100-year pandemic, that's actually not a bad outcome.
Yeah. Steve, I understand everything you're suggesting. I need to address that. I felt bullied when we're in the pandemic, coming out of it, the time where the vaccine is unraveling and unrolling and unfolding, because at my academic institution, which I highlight because maybe it'd be different in my neighborhood, where there's a different moral compass, not a better or worse one, but the cultures are different. In the streets, in the neighborhoods versus at the most prestigious academic institution, maybe in the world. But my classmates weren't very friendly when I described my mistrust for the vaccine. And the institution wasn't friendly either. Steve, the reason that matters is because there are gonna be more medical advancements. The medical industry is gonna have software updates that we might not want, we might not agree with. We, before American medicine, were surviving beautifully in different places around the world. And so there's some history that tells us that everything that the FDA says we need, we might not need. Or everything that the store sells might not be good for us to buy. I don't like that I felt bullied, Steve, because it stripped me of my own autonomy, which is dehumanizing. Because if to be human is to make choice for self, taking away by social consequence my desire to make choice for self at a time, especially where there's so much weight on a decision about a product that's developed faster than what is normally developed and approved. I'm upset and saddened by that, Steve, but I'm mostly saddened because of the potential implications for behavior like that around the world after the pandemic. What happens when there's a new pandemic? What happens when there are new diseases that arise? So there's a thank you to you for your consciousness about the need for autonomy on choices like this, because that re-inspires for me a hope. You guys are the decision makers, Steve, when you're sitting in those seats. And if you want guys like me, I have 11 siblings, all my friends are watching the conversations that you're putting out, that you're having, that your colleagues are having at that time and today. If those decisions don't tell me that you respect me in a way that would allow me to choose for me, Steve, then this future we're talking about where there's equity, and this future where we're talking about there's safety, and this future where we're saying men and women have equal opportunity, that future can't exist if decision makers are disabling any population, any groups of people from making a choice with all the information, Steve.
RuQuan actually very eloquently stated, and I was going to use the A word, autonomy, as you're talking about the experience that you had. And I'll give you another doctor example. I'm sitting across the table from a patient who has a pretty bad disease, and I'm recommending a course of treatment. First of all, that patient's got to trust me that I'm doing the best thing I can for them. But that patient says, I want to go to South America and get kumquats to treat my cancer. I don't want the treatment. Now, in my mind, I'm thinking, I don't have any medical information to say that kumquats is a good thing to do. But do I say to that person, you're stupid, you're wrong, I'm going to force you to get this treatment here in my clinic? No. It's the essence of autonomy. You've heard the risks and benefits, you've heard from different sources, you've made a decision that you think is right for you. Now, some people argue that COVID was different because, RuQuan, and I don't know how old you are, but as a young person, you could be asymptomatic and have COVID and spread that to someone who's more vulnerable. So that was the big argument behind this. Now, there are ways to solve that problem, but we have to have a very, very, very high bar to eliminating autonomy and choices. That bar has to be way up here, and we have to be willing to tolerate some risk In my opinion, COVID did not reach that bar. And so forcing people to do something that they felt uncomfortable with. But the other flip side of it is what we talked about before. Tell people the truth. Tell people exactly the truth about what you learned about the vaccine and what are the limitations of that knowledge, and then let them make a decision. Again, folks aren't stupid. This is their own health. They'll get what you're saying as long as you say it in a way that's understandable to folks. So I hear your frustration. I don't blame you. It's authoritarian to some extent in that forcing you to do something against your will, unless there's a really good reason and that bar is reached, is problematic. And I can hear where you're coming from. I do want to acknowledge that and have benevolence towards folks who have the other point of view, not because I necessarily think they're right, because I don't, but because it came from a place of we need to protect the most vulnerable, and this is the best way we think we can.
Yeah.
Again, that bar has to be really high, and we have to be really careful about making those decisions.
Yeah, you're right. I just put out a piece about, poor Black people being at the most prestigious academic institutions being a necessity, because essentially the academic is designing products, literature, that will inform society, doctors, lawyers, lawmakers, policy writers, and everyone else on how to go about the issues that are a part of our everyday rhetoric, whether it be violence, whether it be disease, whether it be social pressure and bullying. And if poor Black people are not in the room when those discussions are happening, it's like not being able to determine where your tax dollars go. There's a level of impact on your own life that you're not a part of the conversation for. So when we discuss, the most vulnerable, I don't just think about poor Black people. I don't just think about old people. I think about anybody, poor white, rich white, whatever it might be, that is not fully aware of all of the information necessary to make a decision.
So true, RuQuan, and it gets to so many of the issues we discussed. And it's the way things are right now. I would say they're better in terms of people thinking about who gets to participate in the decisions, who gets to contribute to the decisions, who gets informed and in what way about the decisions that go into products, for example. That I think is getting better, and I think we can be a significant part of that. But it gets to in some sense, and push back on me what I'm about to say, we're extending the tragedy of Henrietta Lacks and Tuskegee, because folks who need to have participation in that conversation might not want to come because they don't trust Steve Hahn or whoever. And it's absolutely critical, and we need folks to participate in any way they can, whether it's giving us feedback about what we're doing or participating in a clinical trial. That is essential.
Yeah.
If you're not part of the process, you're less likely to trust what comes out of it. Just like you said in terms of how are my taxes spent.
Yeah, well put. There seems to be additional dilemma about, like the woman described to you, this feeling of the decision makers only coming when
we need you. Yep.
Precisely.
When I want something from you.
Which is interesting, because the people that we're ignoring have so much more to offer than a temporary survey or than an exchange for a $25 gift card.
That's almost insulting, by the way,
Yeah.
The $25 gift card.
I agree, but it's like you never see it go past $25.
We have to have you help us design our clinical trials.
And I'm happy to do it, because when we think about design, the thing that's missing in the design process is a love for people. We do love money. There's none of us are gonna question if we love money. But we start to get a little bit quiet once we start describing loving ourselves or loving people. It's like how we told LeBron, shut up and dribble. You tell the businessman not to describe anything related to his feelings or his emotions, because business shouldn't be personal. You almost have to close one of your eyes to the harm that you're gonna cause. So as we discuss the vulnerable, it's I come from poor Black neighborhoods, but I resonate with poor white people too. because this is still an audience that nobody's asking how they feel. Nobody's asking what they're going through. We don't research poor white people in school. And we also don't research poor black people in school. But we don't. It's unfortunate that like the agenda for us is not one about serving society, helping all of the population. There's a very particular, based on my eyes, just my eyes, there's a very particular group, not even coded by race, I think probably more so by class, who can afford the medicine you're talking about, Steve, who can afford the education we're describing and the SAT prep we're describing. So when we're designing product, especially if we talk about we believe in love, Steve, it's absolutely, if we believe in a love for humanity like most people would say they do, we have to design product that everyone can benefit from.
I 100% agree. RuQuan, let's do it. I mean, let's work together to do that, because at the end of the day, that love manifests itself as helping as many people as we possibly can, and particularly those who've been left behind. So I'm with you on that one. I hope you're with me.
Yeah, we're good.
I think the other thing that I wanted to bring up with what you just said, though, was to me, it kind of goes sort of, it's part of the product development process, but it's much bigger than that in terms of, I would rather have a conversation rather than about Harbinger's products, about why it's so important to do what we're trying to do, which is ultimately at the end of the day, how can my grandkids, your kids, live in a world where we have little to no fear of cancer?
Yeah.
Because everybody gets screened for it,
Yep.
and we find it early and it's curable, and it doesn't make people sick to get it. Yep. How do we get there and make sure everybody comes along with this? So how are we going to do that? How are we going to bridge that gap? Because I got 3 grandkids, and I want them to live in that world.
Yeah, Steve, I believe in that with you. And I know it's possible, especially because there are people out there, there are organizations, there are companies, there are legislators, there are presidents that care and that are using their resources to show that. In my hood, you know, there's a guy who's in prison for at least 20 years. And he taught me to follow the money. If I want to know why decisions are being made or what decisions are being made, to always look where the money is going. And that's how we see sometimes what people care about is what are they buying, what are they investing in, where are they spending their time? That's what the economists will tell you too, is how to see what people care about. Now, unfortunately, Steve, the decision makers, again, as we described them, have not been on the largest scale doing that work, but that's what makes us important, Steve. So I feel confident about our ability because we're here. Like we're already doing it,
yeah.
Right? And there's tremendous upside for us to continue that work. What I think about, Steve, is this. You're right about the need for not just a discussion about product, but a need for a discussion about process and our programming as well. How are we programmed? What processes does that inspire? And then what products do we build out of that? Product, I think, should be the third conversation. I'm okay with that. And the reason why it's going to be effective to have that type of conversation, particularly about our programming, though, that's like, what do we believe about ourselves and each other? That's where the software update is necessary. You can't have new features until there's been an internal update. And that's the programming that needs to happen. And then in cancer care, there will be improvements. There will also be improvements in food. There will also be improvements in water distribution because Flint, Michigan still don't have no clean water.
Yeah. Ooh, a whole nother issue that probably needs to be talked about.
Absolutely. But it's the programming. It's like, whoever's making the decisions there probably is not thinking what you and me are thinking, or else there may be a different outcome.
It may be about the budget or, yeah. So I'm going to throw out something, a little challenge, and I'd love your reaction to it. So yeah, follow the money. You'll often see where people's priorities are. But I truly believe what I'm going to say, and it may be that I'm foolish, and it may be that I'm naive. But not once in my career has this not been true, and that is, you do the right thing in healthcare, for human beings, you create something that people need and want, and you do the right thing with that, you will make money. I truly believe that. And so focusing on what's important for people and developing things that's good and right and needed, the investors in our company will make money. I'm convinced of that. But it could be wrong, could be naive.
At the same time, it's probably most effective for us to use our energy thinking about the fact that we already have built a product together. We've already done it. And so that means that the possibility is there. I think our responsibility is to continue to build. And you don't build 40,000 products just for the sake of it. What you do is we master these ones that we are building. We have a communicative experience that is so powerful, that is so inspiring, that moves the needle in tech, that moves the needle in science, that moves the needle in academic literature and in social conversation. If you do that, then we know the effectiveness of the product and we can decide what other things need to be designed, Steve. So I feel confident despite some of those challenges and barriers that have existed. What I do think is, I was happy to meet you, Steve, because as we began to talk, we walked from maybe about half a mile from Harvard Art Museum to Mass Ave. And that's a 12, 15-minute walk. And we laughed and we discussed fashion a little bit.
Yes, we did.
Or we talked about...
Or lack thereof.
Yeah, maybe, right? We're trying to get you right, Steve.
And so, RuQuan, that's a pretty big hill to climb.
It's okay. Listen, that's a part of this game. All the hills we're trying to climb are big. So we're going to stop climbing and start flying. That's what we've been designing the products that are going to take us straight from the bottom to the top of the hill, Steve. So as we look at the conversation we had, I was inspired. I had fun, right? And I come from the hood. We ain't really interact with white men that much. Maybe the police, you know what I mean? But you try to stay away from that as much as you can, you know what I mean? Maybe a teacher every now and then in my neighborhood, but to be able to come into it with a software update that allows me to see you not as a white man or as an old man, but as a guy who's designing product and has a mission. I'm like inspired by that. And as we engage in conversation, that's actually where we meet, because your desire is to build things that are going to truly and positively bring that social impact that you're describing, which we know, if beautifully designed, your bank account being full will certainly follow. That's easy work.
Right.
It's math.
Right.
So
math.
I was inspired by that, Steve. Tell me where you get your openness, your ability to engage. Where does that come from, Steve?
Well, first of all, I'm going to interject one thing, and that is you inspire me. And you have all the necessary requisites to be successful. You're smart, you're articulate, etc. But the one thing that's really going to serve you well, and that I absolutely love about you, is you're not afraid. Or you seem not to be afraid. I mean, everybody has fears, let's face it. But
no, you're right. I'm not scared.
Yeah,
you're right.
That's great. And you know what? It's like the first step, right? I could be saying I'm afraid to have this conversation with you because it's too uncomfortable for me. We could all do that, but we're not, right? I often say it's really hard for people to escape their parents. And that could be not necessarily your biological parents, but the people who raised you and the environment you're in. And I spoke a little bit about my family before, which is really important. And like you, it's a bond we have, how important our family is. And I think I got it from my parents and the family environment that they created. Tell the truth.
Yep.
Do the right thing. Help other people.
Yep.
Live in your faith.
Mm-hmm.
And it so helped me be a doctor. So humans are humans. People make mistakes all the time. I mean, that happens. You just can't, no one's perfect. Do you know the number one reason, and it's going to sound horrible to you, but the number one reason that doctors get sued when they make mistakes?
Nope.
Because they're not honest with people,
Oh.
and they don't tell the truth if it happens, not all, but some, and because folks don't like them. So you're genuine, you're authentic, you tell the truth. Now, the reason to do that isn't because you don't want to be sued, it's because it's the right thing to do, so it gets back to everything that we're saying.
Yeah, but it comes with some benefits.
It does, and if you're not going to do it for any other reason than the benefits that are ascribed to you from it, then do it for that. But at the end of the day, it's the guiding principle. It's the North Star.
It sounds like we're calling for a software update in society, particularly with the decision makers, because we know that not only is it the right thing to do, to be honest, to build things that serve all people, to break down some of the barriers to access, to reinvent, the processes or improve the processes by which care is received and to mend the relationships. We know that's important, but it seems like some people have a fear that they lose out on the goodness, on the profit, on the things that are important to them. What I'm hearing from us is that doing the right thing has this moral and social good, but it also will yield returns that you're proud of. And I'm sad that people don't know that. But as we wrap up, Steve, I want to know your vision on what is the future if we continue to move in the way that we're moving, if we continue to design the way that we're designing, if we continue to bring the team members around us that we have. What is the future of cancer care or health care or biotech? What does it look like and feel like based on the principles we're describing?
Well, based upon the principles we're describing, the future looks, I think, incredibly bright. But we have to focus on what's real and what's important. We have to focus on how do we design and implement, produce, talk about the things we're doing. There's plenty of great science out there, plenty of great science to advance human health. We're in the biological century, as people talk about. There's going to be amazing type therapies. Look at the advances in sickle cell. I mean, look at that. That's a miracle, a gift from God. It's just unbelievable that you could possibly cure somebody with sickle cell anemia. So these things are coming. We have to make them accessible to people, and we have to have people trust them. So just like the vaccine, what do we know about it? What kind of rigor was it tested? Who is it tested on? What do they have to say about it? What are the risks? And can I, as an autonomous person, make a decision about whether I want the therapy? And frankly, can the system or I afford to get that therapy? All those things get into it. Now, we're at Harbinger Health developing, just an example, products to help identify folks who are at risk of cancer, and hopefully find it really early so that they can be cured and we can reduce the fear of cancer. That's great, but that's only step one. So our journey is long, because it's not just saying, yeah, Mrs. Smith lives in East Texas like I described. I think you might have a cancer that's early stage and can be treated. Now we got to find you a doctor in a hospital, somebody you trust and you can talk to get the right treatment at the right time, and then to follow you through that treatment and to basically, and I mean this in a good way, hold your hand, because it's not going to be an easy course for folks to go through. So there's so many steps that we have to consider here, beginning of the journey, but it's a really exciting journey, and the vision is that Mrs. Smith gets cured, sees her grandkids, sees her great-grandkids, and is living a great life that then her grandkids get as a legacy from her and from others.
Well, Steve, I'm certainly inspired and excited about what you guys are building, what we are building, and what's being built around us. So thank you for this conversation, Steve, and I'm excited to continue doing the work.
Thanks, RuQuan.
Thank you.